is out. So let me know if you guys can hear me. If I'm coming in loud and clear, I'll wait for your commentary, and then we'll do we'll dive in. Okay, looks like we're in and running. So let's dive into your questions. Look, if you're new to the show, and you've got questions you want me to answer, we're focusing. We're going to try to predominantly focus today on the topic of the week, which is joint, muscle, and nerve issues and pain. And I'll do as much as I can to get those types of questions answered. However, if you have other questions and I can get to them, I will. Go ahead and start typing those in. Again, you can do that in the chat or the feed, just depending on where you're watching us. So let's dive in. Rick P. Hi, Dr. Osborne. In reading about weightlifting, 40-year-old, is it true that one of the biggest drivers of your health is muscle mass? Could you give your point of view to understand the basis? Yes, it is true that one of the biggest drivers of our health is muscle mass. Now, there's a limitation to how much mass in terms of it, just like with anything else, there's what's called a dose response curve, where more to a certain point is good, but beyond that, there's really not a greater advantage. So like for those of you who are thinking, okay, do I need to look like Arnold Schwarzenegger or, Sylvester Stallone in their prime? The answer is no. But there is a limitation, again, to building massive amounts of muscle in terms of your overall health. But muscle mass itself, we should be lean, we should be functional. One of the things about muscle mass that is very, very critical and important for overall health is that muscle, aside from the fact that muscle helps to improve your insulin response, so it helps to regulate glucose, blood flow driving through your body. Muscle is actually a secondary pump. Your heart is a primary pump. Your muscles are also a pump for blood vessels and oxygen, but also a pump for your lymphatic system so that it helps you to basically clean your blood and detoxify your system. Muscles are also a reserve tank for protein, right? And so we think of all the different areas where our body needs protein to manifest great health. One of the big ones is our immune systems require protein in order to produce antibodies to help protect us from general day-to-day exposures that we might get from things like viruses, bacteria, parasites, or even other things that our immune system might be exposed to, like environmental chemicals or toxins, compounds in food that maybe our bodies don't agree with. So muscle serves to do all of those things. And so again, good muscle mass is going to be a fantastic indicator for longevity. It's one of the key factors for longevity is lean mass. Again, you don't have to be massive. You don't have to be a beast, but good lean mass is a fantastic indicator for longevity for many reasons, but those are a few of them. What are the optimal levels of iron and ferritin? Mario wants to know. So it depends whether you're female or male. And it depends on your age as well. So this is especially true of females who are menstruating, because when you have a menstrual cycle, you're losing iron every month on a regularly scheduled basis. So if you're female and you're looking at your ferritin levels, ideally they should be at somewhere between 70 and 90 as a kind of a bottom for a bottom level of good. If you're a male, the same thing holds true, but you don't need your ferritin to be super high, but 70 to 90 would be the bottom range. As far as iron is concerned, 60 to 90 is a pretty good place for your iron to be. Again, if you're a female and you find that during your cycle and you have heavy blood loss, you might look at higher levels depending on, again, on your cycle, so that when you do have your cycle, you're not kind of waning back and forth between iron deficiency, anemia, and normal iron levels, because it can take several weeks for your iron levels to pick back up after a cycle. So if they're already on the bottom of the range, you can go back and forth between a transient anemia, and that's not going to serve you very well, because this is one of the reasons why a lot of women suffer with severe brain fog and fatigue and lethargy and dizziness when they go through their cycles, because their iron levels were okay, and then they lost the blood, and now they're in a state of anemia, and then it takes a couple of weeks, and then they feel better, and then right back again to cycle time. And so it's this very cyclical pattern of fatigue that can ensue. So keeping that iron somewhere above 60, keeping that ferritin somewhere above 70, ideal for menstruating females. Can you please discuss how to strengthen weakened muscles, damaged joints, and pain from Lyme and chronic inflammatory response? So mold, Lyme, the same way you would strengthen if you didn't have a history of those conditions. The way we strengthen muscle and joints is movement and use. Just like with anything else, the muscles respond to movement, and if you're moving, then your muscles are being engaged, and when your muscles are being engaged, they're happy, and they're going to be stimulated. The blood flow is going to be stimulated to them. The oxygen is going to be stimulated to them. And they're going to respond by adapting to that movement. And part of that adaptation is to make sure that they get stronger if they're weak. And the same thing is true of your joints. So when you're moving your muscles, the muscles surround joints. Like, for example, if we just take, for example, somebody with, generally somebody with Lyme, if they've developed like a rheumatoid Lyme joint pain, and let's say it's in the elbow, the muscles that traverse the elbow, which are your triceps, your biceps, your brachioradialis, those different muscles, when they're really tight, small, and compressed, they're going to compress the elbow joint, creating more friction in the joint when you go to move it. So strengthening those and loosening them at the same time. So it's important that you don't just work out to build strength, but that you also work out for flexibility, for full range of motion. Because if not, you get really bigger muscles but tighter joints, and remember, joints don't have a direct blood supply to the cartilage. That cartilage is nourished through motion and movement. So if your movement is restricted because your muscles get too big, then you can slow down the progression of healing the joint. So you definitely want to make sure that you're moving to build strength, but that you're also focusing on your flexibility as well. But and that's, again, it's true of no matter any disease that you have. The only conundrum for, let's say, Lyme would be if you have Lyme, or if you have Lyme, you might not have the capacity to properly exercise because of fatigue or other reasons. And in that regard, you might have to take and look at your exercise with a grain of salt and do less as opposed to doing more. But all that being said, exercise is done to tolerance. And we have a crash course on exercise that you can check out. It's on our YouTube channel. So if you're watching on YouTube, just type in crash course exercise, and you should be able to find that video in my archive of over 1,500 videos, and watch for more details on how to begin an exercise program and why that's so important. But I wouldn't look at putting somebody who had Lyme through it, any other different kind of, as long as we had the pain under control. I mean, exercise has its fundamental premise, and you want to start with fundamentals first. Let's see here. Is it true that we need twice as much potassium as we do need sodium? For the most part, yes. I mean, if we look at generally what humans thrive on, what cardiovascular health thrives on, it's a 2-to-1 ratio. So for every 5,000 milligrams of potassium, 2,500 milligrams of sodium is a pretty safe bet. Now there are nuances to that, but again, as an overall general rule, where most people struggle here is their potassium is too low because they don't eat any real food, and they're eating all processed food. And so there's salt in processed food in the form of sodium chloride, but then there's also things like MSG, which is another source of sodium. Generally speaking, if you're making your food at home, you don't run into those problems of chemically bleached salts and MSG. So your sodium content is dramatically lower. And even if you're not eating a ton of vegetables, which is where a lot of our potassium comes from, you'll still be okay because your overall sodium levels are not dominating. Sodium and potassium kind of work coherently together to regulate voltage gated channels and nerves and in muscles. And so, this is why it affects the heart to such a great degree, because the heart's a muscle. Opal wants to know, can you tell me about follicular lymphoma and how it affects joints and muscles? Well, lymphoma, what I would suggest is, if you have been diagnosed with lymphoma, especially like a non-Hodgkin's, which is follicular lymphoma, it's what that is, then you want you want to go on a gluten-free diet for sure. There's a lot of medical research and evidence showing that this type of lymphoma can actually be improved with gluten-free diets, so in my opinion. And I've seen cases of lymphoma go away with gluten-free diets, and that's not to say that everyone with lymphoma has lymphoma over a gluten issue, but many of them do. And so that would be a really easy thing for you to begin the process of doing. Remember that gluten-induced inflammation can also affect your joints and muscles. And so if you've got a gluten-induced lymphoma, you can, gluten is not, when you're reacting to gluten, it doesn't just select one area of your body to hurt. It systemically can inflame you, and that includes your joints and muscles. So changing your diet might just have a major impact on your joints and muscles. The other thing that you want to do, if you've been diagnosed with lymphoma, depending on how you're choosing to treat it, if you're going the medical route, you really should have your nutritional levels checked, and you should support your body and its nutritional needs aggressively during that time, because otherwise a lot of the treatments are very nutrient depleting and very potentially detrimental to the intestines overall, which can cause malabsorption syndromes, which can lead to further deterioration of your joints and muscles. So you definitely want to look at your nutrition. Last night I went for a 30-minute walk. When I came back, my feet itched so bad I thought I'd gotten bitten really bad. I was not bitten. I can't figure out what the issue was. Sometimes when people get up and do exercise, if there is a blood flow issue, you'll get a burning sensation. You can get a burning sensation, not only in just the feet, but also the hands. Depending on the aggressiveness of the walk or of the run. And this can actually be caused as a result of poor blood flow. That would be the first suspicion that I might have, Pamela. So I don't know if you've ever had a blood draw where a phlebotomist made a comment that it was really hard to get your blood out of you, or that your blood was really thick. But in that type of case, there's several things nutritionally that can be done. Number one, obviously get your nutrition checked, but very simple thing to do is taking omega-3 rich in EPA. EPA has a viscosity effect on the blood, so it helps the blood thickness. If it's too thick, EPA actually can help reduce that. And so, you might have an issue with your omega-3 content in your diet, leading to blood pooling and oxidative damage in your extremities when you're going for a walk in that nature. And sometimes it can be transient. It doesn't have to happen every time you do it. I've seen cases where people were their diets were really poor for a week because of vacation or whatever, and this was a symptom or a side effect that began to happen as a result of that diet shift. So I would start by thinking about what you've been doing, and whether or not that's playing a role in damaging your ability to have good blood circulation. Let's see here. Frida, mistletoe injections are said to stimulate the immune system. Would they be counterindicated if a person has an autoimmune challenge, such as hypothyroid? Not really. Look, I'm not an expert in mistletoe or mistletoe injections, so I don't want to come across as if I am. But as a general rule of thumb, the same analogy is usually drawn with herbs like echinacea, which is an immune system affecting herbal. Autoimmune disease, unlike what most people think, when you stimulate your immune system, it doesn't necessarily mean that you make your autoimmune disease worse. A lot of autoimmune reactions are inflammatory for different reasons. It's not necessarily just that the immune system is too strong. I've seen a number of people with autoimmune disease do perfectly fine with herbals that have a stimulating effect on the immune system without contraindication. So I'm not a big fan of that camp. What type of results when treating early Parkinson-like symptoms? In terms of what? I'm not sure what you mean, Harvey. What type of results have I seen clinically with people who have Parkinson's? If it's early onset, usually pretty good, but it also depends on why they have Parkinson's. I mean, there are different triggers, in my experience, for Parkinson's. As an example, I've seen cases where heavy metal was a major trigger, and so things like lead or cadmium And if a person is not aware of that and is not addressing that issue, then they can change their diet all they want. It's not really going to be all that helpful. I've also seen cases where Parkinson's was triggered as a result of nutritional deficit, things like copper and vitamin C deficiency. I've seen Parkinson's improve dramatically with gluten and grain-free diets. So again, it depends on what the person's triggers are, but if you're catching it pretty early, then there's a lot of hope for improvement. If you're catching it 15 years after the fact, and your muscles have already developed severe cogwheel rigidity, and you're not capable of functioning anymore, I generally would say it's not that you couldn't see improvement, but you're probably not going to see a full reversal. Let's see here. I wake every morning with severe neck pain. My NA wanted me to go to a doctor who does PRP. She does it also. Can you tell me what this could be about? So if you're waking every day with severe neck pain, there's a lot to unpack there, Barbara. So I'm just going to kind of give you some ideas to think about. Number one, if you're waking every day with severe neck pain, it could be your pillow. I've seen this happen countless times in folks where their pillow was a terrible pillow for them, right? And so what it did is it put their neck in a compromised position all throughout the night as they were trying to sleep. And so when they wake up, their muscles have actually been activated all night, or have been let's just say, depending on the pillow and depending on how you sleep, the muscles have been in balance for 8 hours instead of being relaxed. And then you can wake up with musculoskeletal pain as a result of that. So check your pillow first and foremost. PRP is not going to do much unless you know why the neck pain exists. So before I did any kind of PRP, which, PRP stands for platelet-rich plasma, and that's usually an injection where they take your platelets or take your blood out of your body and they spin down your platelets and then re-inject those back into the tissue, because there are anti-inflammatory and stem cell-like properties to those platelet-rich peptides. And so that for many people can be very helpful. But if you don't solve why the neck started to hurt in the first place, like if you have a herniated disc, or if you have severe, what's known as facet imbrication in the cervical spine, these things are not going to be fixed per se by PRP. So get your neck evaluated. I would recommend probably one of the best types of doctors to evaluate general musculoskeletal, neuromusculoskeletal pain in the neck is a good chiropractor. So find a good chiropractor with a good reputation in your area, and let them do an analysis and an exam on you and give you a little bit more detail as to why that's happening. And then once you figure that part out, then you could use PRP or incorporate PRP potentially as something that might be helpful or adjunctive to other changes that may need to be made. But generally by itself, with no other forms of care and without asking why the pain exists, PRP is going to be very self-limited in its impact to help you. Is there a non-surgical remedy for carpal tunnel? Yes, very much so. I see a lot of cases of carpal tunnel that are resolved as a result of diet change. Remember, the carpal tunnel right here in the wrist can become compressed. Usually that's as a result of inflammation and swelling and water retention. So that band that wraps around the carpal tunnel, it compresses, and it compresses that median nerve that feeds your hand. And so if you change your diet, you can reduce a lot of that extensive water and a lot of that potential for inflammation that you're holding on to in that wrist. And the carpal tunnel can go away, again, with diet change all by itself. There are also occasions where there can be misalignments in the carpal bones of your hand, of your wrist. And so sometimes manipulation, a good chiropractor can do that. Good manipulation of that region can sometimes relieve carpal tunnel in a non-surgical way. Acupuncture I've seen be very effective for carpal tunnel. Again, another non-surgical option. I've seen laser therapy treatments work really well. Laser, not invasive laser surgeries, but laser, low light laser therapies on the actual carpal tunnel itself as being effective. Let's see here. My joints get locked up daily. I have to snap or crack them to unlock them. I'm mid-40s, work 2 jobs, lift 20 to 40 pounds, wait 3 days per week. Is there anything could do differently or supplement? It's hard to answer that for sure, because without being able to witness what kinds of snaps and cracks you're experiencing and what kind of locking that you're experiencing. But I would suggest, as just a general, try this first, is really focus on stretching your fascia around those joints. A lot of people, they want to lift weights, and there's nothing wrong. Again, there's nothing wrong with lifting weights. I like to lift weights, but if you don't, so there's three aspects to exercise, right? There's strength training, there's cardiovascular aspect to exercise, and then there is a flexibility aspect to exercise. Most people forget about the flexibility part, and so they have tighter muscles, tighter joints, and that's where a lot of that popping, snapping, and locking can occur. So focusing on stretching of those joints. I like to stretch for 10 minutes before I go to bed. I like to every day before I go work out, I stretch out and really lubricate my joints before doing any kind of major lifting. So you don't forget that part. Most people do, and then they pay a price because their joints become compressed as a result of tightness because they're not addressing their flexibility. Is Parkinson's an autoimmune condition or genetic? It's predominantly, as far as we know, it's autoimmune. I would say there are genetic components to it, Imola, but I wouldn't blame genes solely on the development of Parkinson's. The best diet to slow down the symptoms, in my experience, is a grain-free diet. So follow the no grain, no pain diet protocol. Especially early on, the quicker you can catch it, generally the better the outcomes. Crystal said, just got my genetic testing back. No question there. So good to know that you've done genetic testing. I would assume you mean for gluten sensitivity. It's the best way to know whether or not a diet change is going to be helpful for you in terms of a gluten-free diet. When is the best time of day to take Ultra Metal Detox? It's not so much what is the best time of the day. If you're using it with that product contains several different ingredients, and so the best way to use it is multiple times a day. So generally, when I'm taking somebody through Metal Detox, I have them take 2 capsules 3 times a day, spaced out over the course of the day, so that we have continuous chelation effect throughout the course of the day. And so I have them do that 6 capsules a day, so 2 caps 3 times a day with food, and I have people do that for 3 days. And then I have them take an 11-day break. So the best way to take it is to cycle it. And one of the reasons why, when you're pulling metal, if you have a lot of metal, especially like lead is kidney toxic. And so if you've got lead in you and you're pulling lead out through your kidneys, then your kidneys are, as that lead's coming out, your kidneys, have to deal with that. And so you chelate 3 days, and then you take an 11-day break to give your kidneys recovery time. But you also have to remember with it, anytime you're doing a metal detoxification, and this is true of metal detox, you're probably going to want to supplement with extra calcium and magnesium, because one of the ingredients in that product is EDTA, and EDTA can bind calcium as well. Calcium, magnesium, and lead all are very similar. So when you're chelating one, you're generally chelating all 3. Now, in Metal Detox, there is an ingredient called shilajit. Shilajit is a very dense, mineral-rich substance that is designed to replace the healthy minerals as you're going through your detox. So that's why that ingredient is in that particular product. So again, shilajit does have minerals, but some people find that if they get too deep into a chelation process, they start experiencing twitching and cramping, and this sometimes can be calcium or magnesium deficits that are occurring. So just again, consider that, and you may take extra calcium and magnesium simultaneously as you're using that product. I take ginger for inflammation. Is it good for pain also? It can be, but it doesn't solve why the inflammation is there. So ginger is great as an anti-inflammatory, but it doesn't solve why the inflammation exists. And this is true of whether it's a drug or whether it's a natural herbal or natural agent. You always want to solve for why is there inflammation, as opposed to taking something that just blocks it. In this way, you can be sure that you don't become addicted to having to take ginger all the time just to control your pain. Let's see here. Crystal says, thank you for saving my life and kids' lives now. I have 3 out of 4 markers. This is why my muscles are sore. Thank you for this test. Well, you're welcome, Crystal. Glad that you were able to get that information and are finding it that valuable. I got GERD ramping my B1 to 100 milligrams. I'm not sure what you're asking there. I got GERD, IMA, ramping my B1 to 100 milligrams. You have to re-ask the question. I just can't make out what you're trying to ask. I'm sensitive to nightshades. Quick question. Is the vitamin A palmitate in your ultra nutrients derived from white potato? No, it is not. So if you're sensitive to nightshade, you'll be okay using that. I've resolved my severe neck and knee pain with drinking homemade broth. That's just a comment from Ivana. Fantastic, Ivana. Thanks for sharing. Is there any way out for glaucoma? Depends. It depends on how advanced it is, how long it's been there. Eyes are responsive to nutritional changes, and I've seen people go back several levels in their prescription for vision when they change their diet. I actually had one person get out of their glasses altogether. Now, that's not everyone, because not everyone's vision problem is as a direct result of bad nutrition, but certainly the best place to start, Akeem, is going to be with diet change, because it's free, it's easy to do, and the impacts are fantastically wonderful. Even if it doesn't fix your glaucoma, you might have health improvements in other aspects of your life. My dentist made my dentures, which has partial metal. What are your thoughts about this metal? I think if you're trying to preserve the integrity of your teeth and they're really bad, then I think, I'm not opposed to certain metals. Now that being said, your dentist should be running, and this is true of any dentist, in my opinion, if they're going to put a permanent retainer in you, or they're going to give you some type of implant or whatever it might be, you should have a test done that tests you as to whether or not you're going to be reactive to the things they're trying to use on you. These are tests, lab tests that any dentist can order, but they measure for the different metals and they measure for the different compounds that are found, let's say like in amalgams or composite fillings, or the materials that bridges are made out of. Well, dentists can measure you to see which things would be best suited for you and your immune system versus not. So before having anything done where you have major things, screwed in or glued in, ask your dentist to do a materials test on you to make sure you're not reactive to the materials they want to use on you. Besides B1 and B12, how do you heal the myelin sheath? I have trouble picking up things. Lyme has destroyed the myelin sheath, and I get nerve flares that wake me in the middle of the night, most nights. Rosemary, B1, B12, B6, B2, CoQ10, copper. These are all nutrients that play a major role in repairing the myelin sheath. Now, all that being said, you can take a good supplement that contains all of those nutrients, like a good high strength quality multivitamin, something like Ultra or multi-nutrients. So those things could be helpful possibly for you. But at the end of the day, if you're past Lyme and you no longer have Lyme, your body should be able to heal. It sounds to me, though, like you're still having flares. So you may not have fully addressed the reason that your myelin is been destroyed or being destroyed. And so no amount of vitamins are going to fix that until you address and deal with the underlying origin of what's generating your problem. And so I would encourage you to find a good doctor who understands Lyme, if that's indeed what you have. And I get a lot of times, the reason I say if that's indeed what you have is I don't ever make assumptions about the accuracy of a prior diagnosis. So a lot of people that I've seen over the years, they come to me and they've got this long list of different diagnoses that they've had. And a lot of times those aren't correct, right? They don't really have those diseases. They have something like those diseases or something that mimics the symptoms of those diseases. But in a lot of cases, what I see, Rosemary, is people that have food-induced neural inflammation, and gluten is a major player in destroying the myelin sheath. And I don't know if you've changed your diet at this point, but I always go back to anytime anybody's got a chronic, either Lyme or chronic mold or chronic infection, you always have to start from the place of diet, because if you're trying to treat those things with either herbals or drugs, if you're not addressing the core of where inflammation may be coming from, which is your diet, then you're going to you're going to fail. You're not going to have let's just say you're not going to have great outcomes. Okay. I would love you to explain why ideal ferritin is 70. So ideal ferritin is not necessarily 70. Ideal low level of ferritin is around 70 for a female who's menstruating, because it's just been my experience when running labs, when we find a menstruating female whose levels are around 70, when they go through their cycle, what we do is we see their levels drop dramatically, sometimes down below 40 and 30. And they have all the signs and symptoms of major chronic iron deficiency anemia. And so they're tired, they're dizzy, they're fatigued, their muscles ache. And so, where that 70 comes from, it's not like there's this ideal in a textbook that somebody's ever said, hey, if it's not this, then it's terrible. It's just that, again, if you're a menstruating female, my experience has been when you start a cycle and there's a heavy blood loss, that ferritin is going to drop rather rapidly. So having a buffer zone of stored ferritin in the liver can be helpful for those individuals. I don't know if that clarifies your question, Joel, but if it doesn't, ask it in a different way. What are your thoughts on Lar bars? Do you eat them on occasion when you're on the go? No, I never eat Lar bars. They're just basically pure sugar, well, with a little bit of nut in them. But I mean, Lar bars are not good for you. One, they're not organic, so I don't really personally eat anything that's not organic. For the most part, I don't eat those kinds of things because I don't want to be exposed to the pesticides. Number two, I don't need that much sugar in my diet. I mean, a dried fruit like that is like a sugar bomb. You're basically extrapolating all the water out of fruit. So all that you're really left with is concentrated fructose. And so that's not going to help you on your journey back, especially if you've got any kind of issues in your GI tract where you have overgrowth of yeast or overgrowth of gram-negative bacteria that thrive on sugar. It can really trend or lead toward or contribute to problems. Now, does that mean that some people don't tolerate Lar bars? Well, no, not necessarily, but it's just not something that I encourage or recommend people do. The biggest reason is they're not organic, and the second biggest reason is they're far too high in fructose and sugar. My mom has a strange dry cough that happens probably every day at times for at least a year. What would you recommend? I'd recommend figuring out why she's got a cough. I mean, I've seen cases of chronic cough, and I even had, this was even the case for myself, chronic dry cough when I was eating gluten. This has been over 20 years now, but I used to cough on a really frequent basis until I cut gluten out of my diet. And when I did that, my cough completely went away, and I never had the problem since. And I've seen that in countless people as well, patients. But there are other reasons that people can develop dry cough as well. There could be an environmental issue in the home. There could be an air quality issue. Some people are reactive to different chemicals, say in their furniture or their carpets or their paints, and that could affect it. Depending on whether or not a person works in a job where they're being exposed to environmental toxins through the lungs. Mold can cause chronic dry cough as well, or lung irritation. As far as NAC is concerned, I assume you mean N-acetylcysteine. If it's a dry cough, you might not get much benefit from NAC. I mean, NAC is a mucolytic. So usually a dry cough, there's not a lot of excessive mucus that's coming up. But if it's a mucus generating cough, so if you've got a lot of mucus and phlegm coming up when the cough, or what we call productive cough, then that in and of itself is not what you're describing, though. And that's generally where NAC works really well, as works well for those productive coughs where there's a lot of mucus trapped in the lung. What's your opinion of donating plasma? And what do you mean in donating plasma? I mean, you want to go donate your plasma? I don't have a problem with people wanting to donate plasma, but I don't know I'm not quite sure where you're going with that question. Maybe clarify for me. What would I take before and after getting on a plane? I would definitely take vitamin C. I take, when I travel, when I get in a tube that's everyone else's air shared, generally I take 5 grams of vitamin C. Some people don't tolerate that much vitamin C, so take what you can tolerate. It's a bowel tolerance issue, so anywhere from 1 to 5 grams of vitamin C for travel before getting on a plane. I also have a formula TC called Virid, and it's a mixture of vitamin C and quercetin and NAC and vitamin A and andrographis and echinacea. And basically it's an immune support formula that I like to take as kind of a shield buffer for those times where I travel and I might get more exposure to, close proximity to others. And then depending on whether or not I was traveling to a different time zone, depending on the difference in that time zone, if it's a 1 hour time zone, I usually wouldn't do something like this. But if it's like a 6+ hour time zone change, or even up to a 2-3 hour time zone change, I might use melatonin as a tool to help regulate my sleep wherever it is that I'm going, depending on how long I'm going to be there. If it's just a fast turnaround, I won't use melatonin. But if I'm traveling somewhere for a week or longer, I might use melatonin as an agent to help adapt me more quickly to the region that I'm traveling to so that I can avoid the jet lag. Do you know any supplement or something that would help the joint pains from oxalate dumping other than diet and time? Yes, calcium. We have a product, Elena, called CalMag, which I would encourage you to maybe try and see if it's helpful. I'd also recommend glucosamine and chondroitin. These are things that can bind to oxalates as they're dumping. And so some people do find relief using them, but those two would be a good place to start. And both of them are relatively inexpensive and easy to find. What can I supplement with diastolic? What can I supplement with for diastolic blood pressure? So, meaning I assume, Satara, that your diastolic blood pressure is too high. The best supplement for elevations in diastolic blood pressure is not a pill, but it's consistent exercise, especially what's known as burst exercise. So like, for example, you might stand up from your chair and run in place for 15 or 20 seconds. That can cause the release of a compound in your bloodstream called nitric oxide, which can vasodilate your blood vessels, leading to drops over time in both your systolic and your diastolic. Now, it will cause a transient elevation first, like immediately after the exercise, your blood pressure obviously will go up. But and when you do that on a regular basis, you'll have a more consistent production of nitric oxide, which over time will lower your blood pressure. But exercise, hands down, is, in my opinion, the best thing that anyone can do for elevations in blood pressure, outside of cutting out all processed foods out of your diet. Because the other reason you'll see blood pressure most commonly be elevated is people who consume heavy levels of processed food on a regular basis. And that includes restaurant food. So you can go out to a restaurant and eat what you think is real food, but when you eat, like a grilled chicken breast at a restaurant, it's probably not real grilled chicken. It's probably chicken parts that are glued together and shaped and has stamped grill lines in it, and it's probably stamped or glued together with something called meat glue, and it's full of sodium and glutamic acid, and it can drive up your pressure. So a lot of what you get at a restaurant, it's just not real food. And restaurants have a lot of tricks to make things look real, but it's generally one of the reasons I don't like to eat out, because the food, usually it's not organic. There's a lot of processing, a lot of salt, a lot of seed oil that gets used, a lot of sugar that gets used in the sauces. And so, those things are terrible, terrible for your blood pressure. So avoiding that and exercising would be, in my opinion, the best way to get your diastolic pressures down naturally. Okay, so this is a great question. How important is human contact, hugs, hand holding, and more for the married folks regarding healing? I think it depends on the person. There's a really great book called Love Language. I think it's Love Language. Don't quote me on the exact title, but if you type in love languages, or you type in what is my love language, there's a book that goes through that whole scenario. Because some people, human contact, hugs, hand holding, physical touch is their love language. And that, for those individuals, it becomes extremely important. Now, there are other people whose love language is not physical touch. And, that's where those things may not be as important. I think human touch is important for everyone to a certain degree, but some much more than others. And so if your love language is physical touch, you definitely, to me, it's going to play a huge role in your recovery, a huge role in how you navigate your healing. Which microgreens are most beneficial for seniors that have high vitamin D already? I don't understand the question. I mean, there's not like one microgreen over another that I would necessarily recommend, regardless of your vitamin D levels, because microgreens are not typically something that are super rich in vitamin D that are going to impact your vitamin D levels significantly. So I don't know, maybe rephrase the question. I'm not quite sure what you mean. So, mechanism where high parathyroid hormone affects the joints, causing groans mentioned in the diagnostic ditty, bones, stones, groan, and psychic overtone. So I'm not real familiar with the diagnostic ditty, but I would say a mechanism behind elevations in parathyroid hormone is that it pulls calcium out of your muscles and out of your joints and your cartilage and your tendons and ligaments. And so you basically are creating a mineral deficit in those tissues that can lead to dysfunction of them. Is low B5 a reason for having a poor stress response and being susceptible to overstimulation? Yes, absolutely. The nickname for vitamin B5 is called the anti-stress factor, right? So it's sometimes also called the anti-graying factor, Eric. But B5 being low, your adrenal glands, which are the organs on top of your kidneys, are very dependent on vitamin B5 to produce the hormones that help you adapt and respond to stress. So if you have low B5, adrenal glands are not going to help you adapt to stress as effectively or efficiently. And this is why people become stress maladapted when their B5 levels are really low, meaning what happens in stress maladaptation is little stresses become big stresses. They can become overstimulated or overstressed as a result of day-to-day things that didn't typically used to stress them out before they had low levels of B5. So very much an important nutrient in the stress response. Specific help for sciatica, depending on the diagnosis. There are different ways you can develop sciatica, but Celeste, one of the most common is a piriformis nerve, or not nerve, the piriformis muscle is too tight, and when that muscle is too tight, it will compress the sciatic nerve and create radicular pain down the posterior aspect of your leg into your foot. So stretching the piriformis, having a program where you can look up piriformis muscle stretches, but that's something that can be very helpful. Sometimes sciatica, though, can also be caused by a disarticulation of spinal joints. So L5S1, that's the fifth lumbar vertebrae as it connects to S1. Sometimes you can get nerve compression in that region that can also create a sciatic distribution of pain. And again, where I would suggest you look for help in that regard would be a good chiropractor, because they can help you accurately diagnose the type of sciatica you have and what treatment might best work for it. Okay, so Therese says, I started your ultra adrenal support. I noticed it has L-tyrosine. Will L-tyrosine affect my thyroid levels? I am hypothyroid. It may or it may not, Teresa. L-tyrosine is the building block to produce thyroid hormone. If you think about thyroid hormone, when your doctor's checking your levels, they usually are measuring something called T4. T4 stands for thyroxine, but the T in T4 is tyrosine. So think of tyrosine as the backbone for your thyroid hormone. And some people are deficient in their overall protein status, but specifically low in tyrosine. And so by getting more tyrosine in, they're giving their body, their thyroid gland, what it needs in terms of raw material to be able to properly produce and support the production of thyroid hormones. So it's very possible that taking L-tyrosine could improve. It's important, if you're on medicine, that you have your doctor monitor your levels. because I have seen cases where individuals were using products with L-tyrosine, and their thyroid medicine became too strong because of that very reason. So it doesn't happen for everyone, but it's not a bad idea to get it checked and to keep your eye on it, especially if you start experiencing symptoms like heart palpitations or hot flashes, trouble sleeping, restless legs, agitation, quick irritability. These are all potential ways that if you're being medicated with thyroid medicine, that you could experience a symptom, again, due to too strong of a dose of thyroid medication. How to rid mycotoxins after getting out of mold? Great question. There's 4 kind of ways to look at how would you get rid of mycotoxins. The mycotoxins themselves are fat soluble. And so the first thing that you have to do is you really have to support the body's ability to convert those fat soluble toxins into water soluble toxins. And so, what helps with that? Well, glutathione, N-acetylcysteine, alpha lipoic acid, vitamin C all help in that. Selenium can also be helpful in that regard. Now, what happens for a lot of people when they're in mold, those particular supplements can make those individuals feel worse if they're not out of the mold yet. So trying to do a mold detox, the first step is you have to be out of the mold. Otherwise, trying to take those supplements is going to make you feel worse and not better. And this, we see a lot of people, one of the side effects of chronic mold exposure is inability to tolerate detoxification supplements very well. So that's one way. You got to turn the fat soluble toxins into water soluble toxins. The second is now you have to support the GI tract's ability, because it's your liver will pump a lot of that into the GI tract. And so one of the things that happens in the gut is, if you're constipated, is those mycotoxins won't come out as effectively, and your bile has a very high attraction or affinity to mycotoxins. So the bile will bind onto your mycotoxins in your gut, and then you reabsorb as much as 90+% of your bile. Bile is recycled. So bile will bind to those toxins when they're trying to leave your gut, and then you'll reabsorb the bile plus the mycotoxin, and those things go straight back to the liver, and you create, it's called enterohepatic trapping, right? Where you trap that mycotoxin, gets trapped between your liver and your gut. The way to offset that is using binding agents. So some of the best binding agents are zeolite and activated carbon or activated charcoal. We have a product called Mycobinder Plus, which is what I typically use with folks if we're trying to support their body's ability to get those mycotoxins out. So binding in the gut becomes important. Other things that you should be considering doing is lots of outdoor time, fresh air, clean air. Nothing is better than that. I mean, a lot of people, when they're mold ill, they're confined either to bed or they're confined to a home, and so they're inside all of the time, and the air quality inside is not conducive to healing or repair, at least not in the long run. So getting outside and getting fresh air as much as you possibly can. You also want to make sure that you're staying very well hydrated so that you're stimulating your kidneys, because one of the ways mycotoxins leave your body is through your kidneys into the urine, and so really making sure you're not dehydrated, because a lot of people, as you're converting those fat soluble toxins into water, if you're not drinking enough, you're not peeing enough. If you're not peeing enough, you're not flushing those toxins out of you enough. So make sure your water level stays really solid through a detoxification protocol. And then another way, it's not supplemental, but it's just tried and true, very good way to detox through the skin, is infrared, using an infrared technology to pull those guys out of you. And so I sweating is one of the most powerful tools for detoxification. Infrared just helps accelerate that. Now, if you're up for it and you have the energy, exercise without air conditioning is a great way to sweat naturally, and it's free. So that's something else you can do. Although I would caution any of you right now, especially if you live in Texas, it's 100+ degrees outside, and the heat index is even higher than that. So, you don't want to get out there in the middle of the day at noon, and work out super aggressively and pass out and hurt yourself. So be aware you can exercise without air conditioning, but know thyself, right? Know your limitations and be safe. Did you recommend willow bark and boswellia for pain relief? Yeah, I did. I have. You've probably seen videos where I've talked about those very ingredients. we have a product, Mary, called White Willow Complex, which is a mixture of white willow bark and boswellia. White willow bark works on what's called cyclooxygenase, which is an enzyme inside the cell membranes of your cells that drives the inflammatory process. So white willow bark is a natural COX inhibitor, whereas boswellia is a natural LOX inhibitor. LOX stands for lipoxygenase. It's another one of the pathways for generating inflammatory compounds in your cell membranes. So that's why we combine those two ingredients for that very reason, is to inhibit both of those cascades and help people overcome. Deborah's asking how to heal muscle and nerve pain. Why are bladder and bowel and nerve pain associated with the pain in my hips? Well, you can have referred pain. So your bowel and bladder can refer pain. If you have inflammation in your bowel or bladder, you can refer pain neurologically to your hips. There's a whole concept behind how pain can traverse through nerves. So, like, for example, let me give you the opposite example, which is what we call viscerosomatic pain referral. It's where an organ is damaged or inflamed, and it shares a similar nerve distribution as a physical structure of the body. So, for example, your heart. People that have heart attacks oftentimes complain of left arm pain, like radiating left arm pain. And it's not their arm that hurts, but the arm and the heart share that same nerve pattern. And so when the heart's inflamed, you'll get a referral pain pattern down the arm. We see the same thing with the gallbladder on the right shoulder blade. When the gallbladder is inflamed, you get right shoulder blade pain. You can see people with liver inflammation have right upper quadrant pain. In the abdomen, you can see people with bladder pain have hip pain, have referral hip pain. You can see people with kidney problems have referral to their low back. So there's all kinds of pain patterns connected to organs. Those organ referrals they're called viscerosomatic referrals. So it's always important, if you're having that, to rule out a viscerosomatic referral. Is the organ what's contributing to the physical pain, or is there a physical pain problem contributing to organ dysfunction? Because the door swings both ways. And so working with a doctor who understands that is going to be a good step in the right direction. Now, if your bladder is the source, a lot of times what we'll see where bladder problems creates almost like a neurological pain to the hips, this can be oxalate toxicity. So if you haven't already had your oxalate levels looked at or considered oxalates or a lower oxalate diet, you might go back, Deborah, and watch my show on low oxalates and learn a little bit more about that and see if it's a right move for you. And then as well, gluten and grain free, because those are also known to cause nerve damage, which can lead to nerve type pains, referring to all over the body. Shortness of breath in hot and humid weather. There are a lot of reasons why that could happen, but for some people it's acclimation. Your body's not acclimated to hot, humid weather. A lot of folks that we'll see, like, for example, that live in kind of more mountainous regions like Colorado, don't do so well when they come to Houston to play football. They're not acclimated to that humid weather. The air is although closer to sea level, there's more oxygen in it. Their bodies are not acclimated to its use, and that heat can be very devastating on their capacity to function physically. So it could be some of that. I don't know, Eric, if there's any more specifics that you can give me where I can be more helpful, but I would say the first step would be, if you're moving somewhere for a long period of time, if you don't acclimate, there may be some other things that need to get checked, to look at that a little bit deeper. Can I take 2 of your CalMag and later 2 magnesium? Is that too much magnesium? Depending on what the dose is. The CalMag, and then you're talking about 2 magnesium, if you're talking about 100 milligram capsules or so of magnesium, you're going to probably end up, if you're taking 2 of each, you're probably going to end up somewhere around 450 milligrams of magnesium. And no, that's not too much. Although I would say that you should be aware that some people, because magnesium is such a popular supplement for people to want to take, some people don't realize that too much magnesium can make you foggy, can make you tired. Not for everyone, but I'm one of them. If I take 150 or more milligrams of magnesium, I'm tired. I don't want to do much. It relaxes me that much. I think a big part of it is because I'm not remotely close to deficient in it, and so it's just too strong. But just be aware that that's one of your cues to know whether or not you're getting too much magnesium. If it just makes you tired and lethargic. Let's see here. How about CBD THC for nerve pain? I'm just not sure how long it's safe. I'm not a fan. Well, let me rephrase that. So if you've got like a permanently damaged nerve and you have severe nerve pain, CBD and THC can be very effective for some. And I've seen some do really well with just CBD by itself, and then I've seen some where CBD plus THC works better. That being said, I'm not opposed to them, although I don't like THC long term. There are, especially depending on how much you're taking, what the dose is. I would also suggest, if there's a chronicity in this, because sometimes we'll see like cancer patients, for example, will go through some type of radiation therapy. The radiation therapy damages the nerves, and now they have nerve pain, and so they're looking just for some type of, humane relief from the intense pain. The long strategy or the long term, you should be looking for the long game of how to help and support that nerve's recovery. And that would be taking B vitamins, B complex vitamins, and taking alpha lipoic acid. If we're just generalizing about how to help support that nerve recovery post trauma or post damage. So those two things I would highly recommend, even if they're not going to solve your problem in the short term, they're going to help you heal over the long haul. Severe cramps in the rib cage when reaching back to one side, probably electrolyte imbalance. Look at whether or not you're properly hydrated and getting enough electrolyte in the food and the diet that you're consuming. Those kind of stitches like that when you try to move, a lot of that is, you're engaging the muscle and the muscle starts to then cramp. A lot of that's electrolyte deficiency. Calcium and magnesium deficiency is very common in that type of symptom. Potassium deficiency, very common as well. But I would definitely suggest looking at your electrolyte levels and addressing those. Inflammation during menopause, even being gluten-free. So where are you inflamed? If you have inflammation during menopause, why is it during menopause? Is it menopause-induced inflammation, or is it just inflammation and you're also going through menopause, Lori? Because that, it's, again, the assumption of the question is that the inflammation is being caused by the menopause, and I would argue that maybe that's not true. Are you grain-free? I would start there. If you're gluten-free, a lot of people go wheat, barley, and rye-free, but continue to eat oats and corn and rice and continue to struggle and continue to have inflammation. So I'd say definitely you want to look at the difference between, the traditional gluten-free diet and the true gluten-free diet. If you're not aware of that terminology, go read my book, No Grain, No Pain, and start applying it, because that may be, a very simple solution for you. Nerve pain, neuropathy, high ACE blood work, and low IgA, IgG1, and IgG4. Yeah, your immune system's on the floor, and you're being exposed to something that's causing nerve damage. And it, in my experience, if we're guesstimating, it's probably either grains or mold, one of those two, because it's very common to see mold cause IgA, IgG, and IgG4 suppression. So I would look at those things first. Can supplementation or lifestyle help with shortness of breath in hot and humid weather? It can, if you have deficiencies in certain nutrients around lung function. So vitamin A, for example, N-acetylcysteine. Another example, zinc. all very critical there. And so it's not uncommon to see people with that issue, with those deficiencies. Okay, so follow up to Lori's question on where's the inflammation? It's in the lumbar spine. So you could have a separate problem that's not related, in your back, that's not related at all to menopause. You could also have a viscerosomatic referral from your uterus, ovaries going into your lumbar spine. That's also a possibility. I don't know if you've had an ultrasound. That might not be a bad idea. So follow up with your doc, get an ultrasound of your lower pelvis, and get an X-ray of your lower back. So if you've got a physical problem in your lower back, that's something that could potentially be easily treated. Although diet change may also still be in order. I drink over 4 gallons of leche, I assume you mean milk, a week. That should hydrate me more than water, right? Not really. Water, right? Water is the best hydrating tool out there. Water with the right amount of food. Remember, food also contains electrolytes. The right food, processed food contains the opposite of what we want for good hydration. But whole, real food contains good amounts of potassium, sodium, magnesium, calcium, other electrolytes that are going to help keep you hydrated. If I want to take magnesium, which one can you take to guard kidney and thyroid? There's not like a specific magnesium that's specific to guard your kidney and thyroid. Magnesium has, depending on which researcher you read, minimum 700 different functions. So, a good chelated version of magnesium, if you feel like that would be beneficial, that could be magnesium glycinate, gluconate, citrate, or again, a lot of different varieties of magnesium that could be helpful. How long may it take to heal leaky gut with no grain, no pain? Well, if diet's the cause of your leaky gut, then your gut turnover time is 2 to 7 days. So guts heal pretty quickly if you have all the triggers under control. So no grain, no pain would address the dietary triggers, but there are other reasons why people develop leaky gut beyond the diet. And so it just depends on if you have other triggers. Okay, I think I'm going to go eat lunch. We got more questions, but stomach's calling, growling pretty good. Look, hopefully you guys got something out of this today. We're here every Thursday to answer your questions in a live format. So make sure to mark your calendar, 12:30 Central Standard Time. We're here to answer your questions. So come back if you've got more questions. And if you haven't already, come visit me at Gluten Free Society, glutenfreesociety.org. Sign up for our newsletter there. We'll send you tons of free information about diet and lifestyle change and nutrition that can shape and change your life for the better. And as always, remember our mission is to save 100 million lives. So to that endeavor, please share this information with friends, family, and loved ones who you think might benefit from it. And we'll see you next Tuesday at 6 p.m. For our next crash course. And we'll see you here back next Thursday for a live Q&A. Have a fantastic weekend. Take care now.